everyone. As I introduce myself, I'm Suyog Sathe. I work as the secretary for the Lysosomal Storage Disorders Support Society in India, and I also work as a director for the International Gaucher Alliance. So I'm here today to present, give you an overview of what our organization is and the overview of the LSD situation in India. So to talk about the LSDSS, so as I mentioned, it is the first patient advocacy group for rare diseases and LSD patients in India, and it was founded back in 2010 when the parents and caregivers of LSD patients had come together in New Delhi for a gathering, and we felt the need to form a formal group and an association to raise our voice to create a collective voice and advocate with the government. This group was formed with the three primary objectives of, first of all, creating awareness about LSDs, which was quite low at that time, and also creating a sustainable healthcare mechanism and a funding model for LSD patients in India, and also promoting early diagnosis and treatment. So to raise the awareness, we have been, conducting various initiatives over the last 12 years. Like we were the first organization to observe the International Rare Disease Day in India back in 2010. And we have also been conducting various other initiatives like disease specific awareness days. Like there are various types of LSDs. LSDs are a group of around 45 to 50 different types of disorders. And so we have been trying to conduct disease specific awareness days. Like Gaucher Day is conducted in October. Then there is MPS Day conducted in May. So different kinds of days. And also we have been conducting CMEs for the healthcare professionals all across India, which has, started giving fruits, and the awareness levels amongst the healthcare professionals have improved substantially over the last few years. And we have also been conducting media awareness campaigns to raise awareness in the general public as well as the policymakers. And as of now, we have around 420 registered patients all across the country with us. So to talk about the key achievements of our organization, as I said, we are the first patient advocacy group in India for rare diseases as well as LSDs. And in 2010, as you can see from the photograph, we were the first to observe the International Rare Disease Day. And in the same year, we collaborated with the ICMR, that is the Indian Council for Medical Research, and All India Institute of Medical Sciences, AIMS, New Delhi, to form a LSD task force, to create a framework for improving the diagnosis as well as awareness about LSDs in India. And we have also managed to successfully secure state-funded treatment for around 80 patients all across the country through judicial intervention. And we have also, working with some public sector undertakings like the ESIC, which is the Employee State Insurance Corporation, who also provide treatment to, the children of some beneficiaries. Apart from that, we have also been working with pharmaceutical companies. For example, Sanofi Genzyme has were providing treatment under the charitable access program since the beginning in 1999. So in fact, I was the first patient to get this treatment back in 1999 through Sanofi's charitable program. And so LSDSS has also worked with other companies like Shire, that is now Takeda, to initiate their charitable program in India, which is benefiting another 120 patients in addition to in addition to the beneficiaries of the Sanofi's program. And apart from that, we have, overcome various other challenges like in 2018, India, transitioned to a new tax regime, that is the GST. And there were some initial teething problems in this regime. For example, even the drugs, life-saving drugs imported under the humanitarian programs were taxed under this regime. But we successfully managed to persuade the finance ministry to exclude LSD drugs from these taxes. And as I said, we have also been working with the judiciary in India, and we have filed court cases in several states in India for several patients. And one of the most important milestones was one of the cases for a young boy based in Delhi. So it was after, so it was in this case that the Delhi High Court directed the central government of India to, formulate a national policy for rare diseases. And in 2017, in fact, the first policy for national policy for rare diseases was formed, which was a landmark policy, and it allocated a sum of around 1 billion Indian rupees for LSD patients in a 60-40 ratio, split between the central and state governments. But unfortunately, this policy was later kept in abeyance and it was replaced by another policy, which is the National Policy for Rare Diseases in 2021. And we have also been recipients of several international recognitions. For example, the Genzymes PAL Award in 2011, as well as Global Gene Champions of Hope Award last year. So to give you an overview about LSDs, as I said, LSDs are a group of around 45 to 50 rare genetic disorders. And so their incidence is quite low, like rare. And for example, most of the LSDs have an incidence of about 1 to 100,000 people worldwide. The most common of those is Gaucher disease, which has an incidence of about 1 in 50,000 people. But combined as a group, LSDs have a incidence of about 1 in 7,000 people worldwide. And the most common LSDs are Gaucher disease, Pompe disease, Fabry disease, and mucosclerosis, that is MPS. So out of these 45 to 50 disorders, treatment is currently available for only 7 LSDs. So the treatment primarily comprises of enzyme replacement therapy, which is the deficient enzyme that needs to be given back to the patient through intravenous infusions, and it is a lifelong treatment. There is also a new therapy for Gaucher disease, that is substrate reduction therapy, which is an oral pill that needs to be taken once daily. And currently it is only available for Gaucher disease, and for other disorders, it is still in research. And there is also gene therapy, which is going on, like the research is going on for Gaucher disease as well as for some other disorders. And for Gaucher disease, there are also clinical trials going on. So as I said, these are extremely rare disorders and they'll need lifelong treatment. So the cost is very prohibitive, and the average cost per patient, annual cost per patient, ranges anywhere between USD 60,000 to anywhere between USD 250,000, depending on the patient's body weight, because the dose of the medicine, varies with the patient's weight. And talking about the registries, so the Indian Council of Medical Research in 2019 came up with a national registry. It is a hospital-based registry in collaboration with AIMS New Delhi, which is aimed to collect, epidemiological data about rare diseases, which was currently lacking. And there are currently around 11,000 cases registered in this registry. So talking about the policy and the resources, so currently we have the National Policy for Rare Diseases, NPRD, which was notified in 2021. And this policy offers a one-time support of around 60,000 US dollars per rare disease patient. And for other disorders like LSDs, which need lifelong treatment, the policy suggests CSR funding and crowdfunding solutions for disorders like LSDs that need very expensive and lifelong treatment. So speaking about the current situation, we have around 420 patients registered with us. And out of these, around 220 patients are receiving treatment through the charitable programs of a couple of pharma companies like Sanofi and Takeda. And around 80 patients are receiving state-funded treatment through the judicial intervention that LSDSS has done. And apart from that, some patients are receiving treatment through the public sector undertakings like ESIC and even the armed forces. But the remaining patients are unfortunately without any treatment, and they have an uncertain future. So the national policy for rare diseases, as I said, it offers only a one-time support of 60,000 USD, which is not enough for disorders like LSDs, which need lifelong treatment. And it suggests CSR and crowdfunding for these kind of disorders, which is again not a sustainable solution. And further, the national policy also has designated 11 centers of excellence all across India, which have great experience and expertise in treating LSDs over the years. So speaking about the challenges we face, so the most important challenge is the costly treatment, because as I said, the annual cost of treatment for a patient can range anywhere between 60,000 USD to 250,000 USD. And so this needs a concrete and a sustainable budgetary allocation from the government. And there is a low awareness about LSDs because, as I said, the prevalence is very low, and so there is a lack of awareness amongst the policymakers as well as the healthcare professionals. And in some parts of the country, especially in the southern parts of the country, there is a practice of consanguinity, so marriages within cousins and blood relations, which further increases the prevalence of such genetic disorders. So there is a need to spread awareness, to prevent such consanguineous marriages. And there is also a problem of diagnostic delays because many of the LSDs have non-specific symptoms. So they are often misdiagnosed for something else. And there is also limited access to, specialized healthcare infrastructure like genetic testing labs, which again, delays the diagnostic process. And also there is a shortage of trained healthcare professionals, which again adds to the delays. So a couple of few suggestions about the recommendations and the roadmap for the future. So first of all, early diagnosis is essential because timely intervention can really, transform the patient's life for the better. So there is a need to implement, programs like the newborn screening program and prenatal screening for early diagnosis. Also, there is a need to expand access to the existing treatments as well as develop new therapies for LSDs. And there is a need to create awareness and launch comprehensive awareness campaigns to improve awareness amongst the policymakers, general public, and even the healthcare professionals. So as I said, there is a need to create a sustainable healthcare funding model, because as of now, it's just a one-time support from the government. So there is a need for a sustainable model, and also there is a need to uh, try and reduce the cost of the existing treatments through various ways, like maybe local or regional manufacturing of the drugs. And also, of course, there is a need for cross-border collaborations between different stakeholders, nationally as well as internationally, because sharing expertise and research findings can really help in the development of new therapies and support. Yeah, that's about it. Thank you very much.